Hello, my name's Natalie. I'm an EMDR certified therapist, and I wanted to take a few minutes today just to talk about facts versus fictions of EMDR, one of my favorite conversations. So, fun fact, EMDR has been around for over 30 years. A lot of people think that it sounds kind of woo-woo, but there's plenty of science to back it up. So just to start with what we know to be a fact, and one really common misconception is that people who are pregnant cannot use EMDR. It used to be believed that that was because it was going to cause fetal distress, harm the baby. But actually what we found is that if that processing of the trauma were to be that bad, just imagine what would happen for that baby to have that parent still be experiencing that trauma ongoing, as far as that trauma loop that keeps getting triggered throughout their daily life. So now it's actually really encouraged for pregnant people to actually do EMDR, so that once the baby's there, that those triggers won't be impacting them as a parent on top of now that baby. Fact or fiction, EMDR can't be used with somebody with a brain injury or seizures. That's actually fiction. So another example of something where we used to think that you just can't do it. What really has to actually be the case is that for someone to be utilizing EMDR with somebody who's had a TBI, I've done lots of work with people with TBIs, concussions, or seizures, is that we need their neurologist or whoever their primary treating care team, someone to write a letter to sign off that EMDR is actually okay. In those instances, we usually don't do eye movements, which was actually what my next fact or fiction question was, which was EMDR only can be done with eye movements, and that's actually not true either. We have tapping that we could utilize for processing for people. There's also buzzers people can hold. There's light bars, which is eye movement, but it's not the same thing as pulling the hands. And then the other piece would be sounds. So we've got headphones people can wear where they can hear sounds as a part of their processing. And in some instances, I'll actually have people stand and do something that in EMDR 2.0 we call the V step. So there's actually a few different ways that we can get the processing going. Fact or fiction, EMDR is only for PTSD. And if you guessed that that was fiction, that was right too, because actually EMDR is for things like tinnitus, phantom limb syndrome, which I was surprised about myself originally, but I love that fun fact. Phantom limb syndrome, we use it for depression, anxiety, phobias, OCD. Now with OCD, it would be a part of that treatment plan, but actually the gold standard would be OCD utilizes ERP and then EMDR as well. So a little bit of an exception there. And then performance, actually EMDR is a really awesome tool, and I love utilizing it for people for helping enhance their performance, whether it be presentations or sports even. It's a really common area. I see a lot of people want to see me for that. Fact or fiction, EMDR is too good to be true. I say it depends on who you talk to, if that's fact or fiction. What I'd say is we get results every time. So if we're properly following EMDR, or as a clinician, I'm guiding my client to properly follow it to the gold standard, the actual protocol, we will get really awesome results. And those results will be long-standing, because the reality is that that information was maladaptively stored. Once we change that for that person, we no longer have that information being maladaptively stored. Their life will change. Their symptoms are gonna go down. So in the instance of like PTSD, that person, when they're done with EMDR, they should no longer meet the criteria for PTSD in the diagnostic DSM-5-TR. So just to note that as one example. So their nightmares should go down. Their hypervigilance shouldn't be notable, even with the previous triggers. It's not too good to be true. What I would say is an example of pain, EMDR is not gonna cure pain. Pain's not gonna go away. What we will see with that pain is that the pain itself will go down some. But as we know, there's a real medical cause for a lot of people's pain. And in that instance, they're just gonna experience what would be there otherwise. EMDR can actually help correct that loop that gets kind of triggered by every time we feel pain, it gets more amplified and kind of keeps going. And as I like to call it, the snowball effect. So EMDR helps with that, but obviously it won't cure the pain. And same thing with depression. EMDR is not gonna cure depression, but what we can do is work on that loop attached to depression that just makes it feel even worse when it does happen for someone, or there's reminders of depression that triggers. Fact or fiction, EMDR can only be utilized if it's been a big enough issue or incident. That kind of goes to earlier comment about PTSD, and that's also, again, fiction. If something's bothering someone, we can use EMDR on it. So please follow me for more. I'm happy to answer any questions and read my blog post as far as if you're curious about the actual structure of how EMDR works as well. Take care.